This program is made possible by CIC Insurance Group. We keep our word.
Hello and welcome to tonight's edition. This is where we get to talk about your health. It's the only platform that we have in the country where we get to give consultation live on air. This is Doctors on Call and I'm George. I'll be taking you through tonight's session. We are live on Family TV and Radio 316 as well. And tonight it's matters pertaining to diet and your mental health. I have Miss Kate Kibara. She's a nutritionist. You've seen her on the show before. Welcome back. Always a pleasure having you on board.
Thank you. It's a pleasure to be here.
Okay, nice to have you as well. We also have Dr. Mutisia. She's not new to the show. Welcome back as well.
Thank you very much.
Okay, and I'm George, as stated earlier on. I don't want to be left out of the introductory remarks, but remember, and this show is all about you. So talk to us, talk to us, talk to us, talk to us. I'll continue emphasizing that on SMS. You can do that on 22316, or just give us a phone call on 0204 200 000. We have a blog as well. You can post your question there. That's familymediaonline.com/docblog. Get to know about detailed about the doctors that we're having on the blog as well. Starting off the show, I'll start with you, Ms. Kibara. It comes to understanding a balanced diet. What does it entail, bearing in mind economic hurdles that are there?
That's a very good question. And the mistake we are making these days, I'm going to talk about today and a balanced diet, and what it is that there's so much information that is out there, information from yourself, from your friends. You're going to, just Google something and you'll know this I'm supposed to eat. So we have a lot of conflicting information when it comes to what you're supposed to eat and how you're supposed to eat. And because there's a lot of stories, I would call them stories, and a lot of myths, especially on weight loss, we find that we don't have the real could I call it a benchmark of knowing how we should eat. A balanced diet is so simple. It's as simple as anything else. And what it entails is that you need to eat all the food groups. You need to have your proteins, you need to have your carbohydrates, you need to have your vitamins and minerals. You're supposed to take a bit of fiber. You should take some sugars, you should take some good fats and oils, you should drink water. As simple as that. But sometimes we complicate it because I'm trying to lose weight. I've heard I should not take any carbohydrates, so I'm not going to touch on carbohydrates, or I should not touch on any proteins, so I don't eat proteins. So in simple terms, a balanced diet, and we studied this in school from when we are very young. What does it mean? Can you eat your proteins, and where do you get your protein source? Healthy proteins, of course, because of lifestyle diseases. So you go to get, you look for lean cuts of meat if you are going to eat red meat. White meat is the best, so you go for organic chicken, you do a lot of fish, and ensure daily you take a bit, like 1 protein meal in a day. And this should contribute about 25% of your RDA, of the amount of energy that you need. And then when it comes to your carbohydrates, you need healthy ones. We take a lot of sugars from soft drinks, from table sugar, from taking refined flours every single day. So you watch to take the healthiest carbohydrates that are there. The thing is to look at what is available for you and then choose the healthiest option. So for carbs, just ensure that you're taking whole meals. They're very good, wholemeal ugali, wholemeal rice. You're taking like oats. When you're doing your cereals, you take like the high fiber foods, and these ones are rich with not only vitamins, and especially the B vitamins. They're also rich in fiber, and they also contain the good fats. And then mix it with a lot of vegetables and fruits, something we miss in our your diet. And this gives you vitamins and minerals that you need, that protective element of your health, and for you to keep well and for your system to operate, you actually need that. Don't forget water. And don't forget the good, a bit of some sweetness in your diet.
Okay, thank
but
you
in the healthy way.
For highlighting that. Dr. Mutisia, I'm going to bring you right into this conversation from your expertise and from what's going on right now. We all have stress, we are all under depression. How do we cope with all this, Dr. Mutisia?
Yes, we all face a lot of stress from different aspects of our life. Stress can come from work, it can come from home, it can come from the environment, it can even come from physical illnesses. For example, if you're diabetic or if you have cancer, that can be stressful to your life. You could also get financial stress, stress from children, from parenting. But basically what is important is for people to actually identify where is my stress coming from by looking at every aspect of their lives. If it's at home, am I relating well with my immediate family? If it's at work, am I happy with my work? Are there things I can change? Are there things I need to change my attitude towards? Do I need to even change my work? So you evaluate all those aspects, and what is most important is to prioritize your areas of life. There are things which are very important, like your health, your family, and your work. Sometimes people will spend a lot of time trying to please as many friends as possible.
Because you want to fit in, Dr. Mutisia. That's
yes,
the point.
social support is very important, but sometimes it can also be overwhelming. Yeah, so you need to prioritize, look at the most important things in your life and put your energy there. And of course, when somebody is stressed, it starts presenting in terms of physical problems. They might even have a lot of colds, indigestion, lack of sleep or excessive sleep in some people, lose appetite. So when you start having a lot of physical complaints, it's good to have an evaluation done.
Okay.
Yes.
And I was sharing with a colleague, and he said, it's very simple. Live within your means. That's the only way you can cope with stress, because in most cases, you know, you want what your neighbor has, and in essence, you can't really get it. So living within your means is also
living within your means. That means even the social interactions, you also see how much can I handle.
Okay.
Because you could spend a lot of time moving from one social event to another to another. You don't get time to exercise. You don't get time to go shop for a balanced diet, what Kate is giving us, because it requires you to go look for vegetables, fresh ones, fruits. Those are not things you will keep in the freezer. So you also need time to be able to take care of yourself.
But how is it to live in your means with this demanding environment that we have today? There's a lot of pressure for you to be, you know, somebody else, or for you to be that person. How do you cope with that as well?
We encourage people not to compare themselves with the next person. Set your goals. Say, today I'm here, tomorrow I want to be in place B. So if you, over the weekend, you planned your whole week. On Monday, I want to do ABC. Tuesday, ABC. Every day in the evening, check your list without checking what your neighbor is doing. Did I accomplish what I wanted to do? Because you cannot compare yourself with other people. You should always be your own best friend.
Setting your own goals.
Yeah, so set your own goals without necessarily comparing with somebody else. Put yourself smart goals, measurable things you can actually attain. And when you succeed at the end of the day, it also helps you to pat yourself and say, at least I did this, celebrate those small achievements.
Okay.
Yes.
And remember, this conversation, I want to make you part of this conversation. You can do that via sending an SMS, indicate your name, where you're watching us from, and the question that you might be having. Just a reminder, I have here with me Ms. Kate Kibara. She's a nutritionist, together with Dr. Catherine Mutisia, a psychiatrist. And you can call in on 0204 200 000. I've received a question from Anne, and the feedback has started getting overwhelming, but we'll try cover the much that we can. Anne is asking if it's okay to use food additives. Would you recommend?
Food additives? It depends. She was not specific. What type of additives are they? Are they the chemical additives, or are they the natural ones? You know, when it comes to, and I don't know whether she's talking about cooking, because when it comes to cooking, you can actually make your food taste better, and that's why we use additives. You can make your food taste better by playing around with what you have there, with the ingredients that you have, because cooking is an art. You can decide to add capsicum or ginger or
what if we are looking at chemical additives?
For me, and as you know, what we have, all additives that are there are recognized. They have a word. They're known as GRAS, G-R-A-S, generally recognized as safe, and that's why we use them in our foods. But too much of it, and there's a lot of research right now, and there's a lot of evidence that's showing that too much of certain chemicals and certain additives, there are those that are carcinogenic. There are those that may create a certain harm into your system. So you don't want to take a lot of, why not take the natural thing? So my own opinion, a lot of additives may not be healthy. Why not use the actual food, the actual flavor that you want? If you want a vanilla flavor, then get the vanilla plant instead of getting a chemical that may be okay at that time, but with time may pose risks of attracting, especially carcinogenics attract cancer. As much as we don't know the real cause of certain cancers, they may risk to that. There's heart palpitations with some of the additives like MSG. There's flashing of the skin. You have others that interfere with the neurotransmitters of the brain. So it's not good to keep on adding things that are not in their natural state in your system, because you're not helping yourself to gain health.
Okay.
Yeah.
And Dr. Mtise, let's take a question from Muhoro. This is from Nakuru. I have lived with schizophrenia for the last 17 years. Now, Muhoro seeks to understand what causes this condition, and is it permanent or it's something that could be treated?
Okay, when we talk about schizophrenia, it's one of the severe mental illnesses we have, and most of the time the client needs to have the medication. They may need to take them for the rest of their life, but it's manageable. We have people who are taking medication and they're able to work and live a normal life. But basically, being one of the severe mental illnesses, it can actually be scary, because when somebody is suffering from the psychotic episode, sometimes they might hear things other people can't hear, they might see things which other people can't see, they might become violent, they might become paranoid. You start thinking even your own family member is planning to poison you. Some people will even refuse to eat food prepared by family members. Yeah, but when the correct diagnosis and the correct medicine is given, the person can live a normal life. Previously, the challenge was the drugs which were available had many side effects, giving you a lot of drowsiness, and so people didn't like those medications. Right now, we have medications which you would take, nobody would be able to tell, and we are getting more medicine with fewer and fewer side effects, and so people are able to live a comfortable life.
Okay.
Yes.
And one of our viewers is seeking clarification. Now he or she is asking, he hasn't really stated the name, but is it true that consuming a lot of meat makes you age faster? How true is that?
You know, in my profession and as a nutritionist, everybody talks about meat today. You'll find red meat especially. You should not eat it. Don't touch it. Like my first answer when we started was that you need to take all the food groups, and animal protein is important because there are those vitamins and minerals that are only provided by the animal source. So if you become a strict vegetarian and decide to do away with it, there are those like B12 you'll may be missing, but does it make you age faster? An unhealthy lifestyle, if you're going to take excesses of everything, will make you look older than, not even the way you appear, your energy levels, you know, your brain capacity, all that is connected to what you put on your plate. So excess intake of animal protein, not only will it give you high cholesterol levels, not only will it make you add weight, not only will it give you problems, especially those who experience a lot of uric acid, not only will it make you have, I don't call it improper digestion because of a lot of load of low fiber in your tummy. Not only will it do that, it may also cause other things that you may not see as a person, but it's true. Too much of unhealthy food, too much of too much of nyama choma, maybe may I specify that, will make you not experience that body and health that you deserve at that time. So if you changed and ate more healthy, if you alternated your protein to more healthy ones, and you did the chomas once in a while and the right portion. If the person is only taking about 50 grams in one sitting, that's what you're supposed to do, then you will find, if you compared yourself, you know, you'd actually see the effects are like day and night.
Okay. Yeah. Dr. Mutisia, there is a question from Maggie. Maggie is 48 years old, and she says hello first. And the question goes, I was diagnosed with bipolar, that's 21 years ago. I've taken my medication very religiously, and of late I feel I'm now in charge of my emotional life. Is there a likelihood of getting out of medication for good in the near future? What's your response to Maggie?
With bipolar mood disorder, basically most of the mental illnesses, a trigger is involved. You could have the predisposition, the genetic predisposition, but there's a trigger. A trigger could be a stressful event, a certain loss, a trauma in your life, which actually precipitates the illness. And so that means that people who are able to identify the sources of stress, live a healthy life, are less stressful, or they manage, let me not say less stressful, manage their stress well, they can actually do better with time, live on very minimal doses of medication. And there are some people who are actually, what we normally do, we taper your medication to the lowest possible, and we can actually give drug holidays, so long as you have social support for somebody to observe. And because these illnesses don't come suddenly, you find that, like, if it's bipolar, you're getting a manic episode, you start talking excessively, you start lacking sleep. So these are things you can monitor. So if there's somebody who is taking care of you and they can observe that, we sometimes give drug holiday and observe. If we give a drug holiday and the symptoms start coming back, then we put you back on the medication. So she should not be afraid. You just needs to talk to their doctor. They start by reducing the medication. They can even go for a drug holiday on condition that they observe the symptoms, and any earliest onset of symptoms, then she can go back to the medicine.
Okay.
Yes.
And moving on, I confirm I've received a question from Anne and Asena, Thruiru, Robert. The list goes on and on. I urge you to continue sending in your questions to 22316, and also call in on 0204 200 000. As of now, it's time for Eat Smart, and this particular evening we're looking at proper dieting during pregnancy. We'll be right back after this.
At CIC Insurance Group, customer service is not a department, it's everyone's job. We know that when the customer comes first, the customer will last. CIC Insurance Group, we keep our word.
On any normal day, everybody must eat healthy, okay? But when you're pregnant, you have to pay more attention. If you've not been eating healthy, you have to pay attention, because you have a fetus that's growing that has to be fully developed or properly developed as God planned for it, and be produced as a healthy child, you get. So you have to pay attention to your eating. So yes, it is extremely important. We need to eat everything, but the question is always how much, okay? So for example, this is how a pregnant person who needs to eat healthy plus control their weight, they probably need to eat like this, okay? Half of their plate is vegetables, and then they have some starch, ugali, sweet potatoes, nduma, and then they have some meat or beans, okay? So that is basic. They need to eat like this. But because people who are pregnant are likely to suffer from anemia and calcium, they also need to pay attention to their iron intake. For example, people have a habit of taking food with tea. Now, when you're pregnant, you can't do that, because when you take food and then you take tea, the caffeine in tea or coffee blocks absorption of iron. The person who's pregnant needs a lot more iron than anybody else. So those are some of the things you cannot do. You need to pay attention to your calcium intake. You get calcium from your vegetables, you get calcium, your greatest source of calcium comes from milk and omena, the little fish, okay? So they need to eat a lot of fish in their diet, and they need to eat a lot of, also take the amount of recommended milk, not a lot of milk, okay? And because during pregnancy they can easily suffer constipation, they must pay attention to their vegetable and fruit intake, and they also must take enough water, you see. So if you've been just living around eating anything, junk food, eating a lot of sugar, a lot of fat in your diet, then you mostly have to pay attention. And then, I mean, there are so many studies that have shown that the way you eat way before pregnancy affects the fetus and is going to affect it for the rest of their life. So now everybody needs to learn to eat healthy. If you're planning one day to have children, you have to eat healthy now, because the things you did 5 years ago that were too much alcohol, too much meat, too much fat, is going to affect that fetus. When you gain too much weight, even you can get into trouble with your blood pressure, you know, and then there's poor outcome. So you need to control your weight. Usually, ideally, when somebody is already classified as overweight before you even conceive, like let's say they are, people know about body mass index. If your body mass index is 30, if your doctor has told you you're obese, you actually should not gain more than like 8 kilos. If you have normal weight, you should gain up to 11 kilos. If you're underweight, then you can get up to 23 kilos. So ideally, and most of this weight, you should gain it in your last trimester. So if you start gaining weight trimester 1, 2, and you're gaining rapid weight, it means you're going to gain a lot of weight, which of course will impact on your health. You'll get a lot of backache, you'll get a lot of, you know, you'll get blood pressure, you'll sweat a lot, you'll be very uncomfortable. So it is very important to watch your intake during pregnancy so that you can actually have a healthy weight for the baby, and so even getting after the baby comes, then you're not going to be suffering from excess weight.
Progress informed by the past and inspired by the future. We have a solution for you. CIC Insurance Group. We keep our word.
Welcome back. This is Doctors on Call. We're live on Family TV and Radio 316 as well. Continue sending in your questions on 22316 or giving us a phone call on 0204200000. And on Doctors on Call, there's always something new in store for you. And this particular evening, I'm giving doctors, the specialists that I have, the platform to ask each other a question. I'm going to start with you, Ms. Kibara, briefly as we go on with the show.
Yes, I have a quick one. How do you relate mental problem with problems with alcoholism? Does it trigger, and if you get into it because of drinking too much or just having a drink, are you able to get out of it? Can you manage that? Because alcohol directly works on your brain cells, you know. So how do you handle that?
How do you handle that?
First of all, some people would use alcohol to treat some anxiety they have or some depression. So instead of dealing with the issue, they start taking alcohol to either get sleep and forget about their problems. So some people get into alcoholism as a result of that. But again, alcohol on its own can actually, one can get addicted and reach a point where they are dependent on the alcohol. If they don't take it, they get sick, they start shaking, they get nightmares, some even hallucinate. So when it has reached addiction, it's that severe. But what worries me most is that most Kenyans do not realize that even this binge drinking over the weekend is harmful to their health. And we say that it would be best if people abstain from alcohol. But those who must take, they need to know that if it's a man, you should not exceed more than 2 drinks, which means 2 beers or 2 glasses of wine or 2 tots of spirits. But most Kenyans do more than that. They will wait and drink on Friday and Saturday, and they drink so much, which is harmful to their health. Okay. Again, addiction runs in the family. So you find that in a family, you might have several people who are addicted to alcohol. It is a disease which is very complicated to treat, so the best thing would be to prevent. But there's treatment for those who are suffering from it.
Dr. Mutisia, briefly, what's your question to Ms. Kibara as we proceed on with the show? I'm putting you on the spot.
The issue of weight loss. I have personally struggled with weight loss. I am succeeding. And I'm sure there are many Kenyans out there.
And in fact, there's a question from Robert Rotich from Nakuru. Robert, in Robert's case, he was told by his nurse that is overweight at 82 kgs, and he needs to shed about 10 kgs fast. Now, Robert, as well as Dr. Mtisia, is asking for your advice. What's your advice, Ms. Kibara, briefly?
You know, in my profession, could I say half of my clients want to lose weight?
Yes.
I have been there. I was very big and I lost about 29, 30 kilos.
Unbelievable.
Yeah, most people don't believe that I did, and that's why I can share this. Weight loss is not easy. You know, it is not something that happens overnight. And as I answer that question, you know, Robert wants it. He wants it fast, you know, immediately. Weight you did not gain weight within a day, within 2 days. It has to be gradual, and drastic weight loss does not work. So what I advise, number one, just change your lifestyle. Don't start thinking about weight loss, because when you put that in your mind, you'll not think, okay, I will have to drink carrot juice or I'll have to do this. First, change your lifestyle. What is a healthy lifestyle? You need to exercise, you need to drink enough water, you need to take the right portions. Once you adapt into that, you don't know that you're indirectly attacking that weight loss problem that you have. And then number two, then now watch on what you're eating, because of course portions and the quality of what you eat is important. You only reduce the quantity of the various food. If you take a lot of carbohydrates, for example, the quality of what you eat, you take a lot of sugars, you replace that with healthy carbohydrates that are high fiber, released slowly into glucose. You find that you're not having a lot of fat deposits in the system. You change from a lot of nyama, you know, a lot of red meat to white meat once in a while. And then you introduce healthy foods. And don't stay hungry, because if you want to lose weight, you know, you must eat more. You have to eat for you to lose weight, not for you to starve yourself, because we starve so slowly, and it is gradual. Every month you watch what is happening, because you've changed your entire lifestyle. I'm sure even what you're discussing, even stress, will affect your weight.
Yes.
So you find that it is that entire cycle that you have changed, but you are specifically watching on what you put on your mouth. And you find within no time, a month, 2 months, and it's a gradual process that your body is changing in the healthy way. If it is drastic, it always comes back.
Okay, so with Robert, with Dr. Mtisia, listen, it's not something that you can do overnight. And just a reminder, our phone line is 0204200000. I'll read to you, Dr. Mtisia, a question from Asenath, all the way from Ruiru. Now, as for Asenath, the question goes, hey, I'm mourning a dear friend who hung herself, we don't know why, had some depression and was on medication. In fact, a week before that action, she had visited a doctor. My question is, Kwani, can it go fast? Can it go bad that fast?
Yeah, it's sad we are losing many people to suicide and depression. And we usually say that when somebody has suicidal thoughts or suicidal ideation, that's one of the psychiatric emergencies we have, such that when somebody tells you, I've been contemplating committing suicide, that is somebody you actually need to admit and watch closely. Depression is the leading cause of suicide. So if we are to treat the symptoms of depression as early as possible, then we'll actually reduce deaths as a result of suicide. Of course, the drug abuse, drugs also contribute a lot, because when one is intoxicated, they are likely to behave in a way they would not normally behave. They are likely to be irrational. So for us to reduce the rates of suicide, we need to reduce the rates of depression. And so the people you are living with, if you realize that your loved one or your family member or your friend or your colleague at work, they seem to be sad, they seem to feel worthless, they don't celebrate any of their achievements, even though they are successful, they still think they minimize their achievements, maximize their problems. It reaches at the extent where somebody doesn't feel like waking up to go to work. Some will write a resignation letter. Some will lock themselves up. So when you start seeing those symptoms, let them get treated. And every registered medical practitioner knows that when somebody talks of suicidal thoughts, and we actually don't wait for them to talk about it, when somebody has symptoms pointing to depression, you ask them, have you thought of committing suicide? Because asking does not actually make them do it. But if you don't ask and you miss it, then you give them the avenue to go and commit suicide. And we've had patients who have actually used the medication they were given by the doctor, the antidepressant, they took an overdose and they died as a result of the medication. So it's very important, even for a loved one. If at home your loved one says, I wish I were dead, it would actually be better to actually observe, be close to that person. Don't leave them alone until the point where you can take them to hospital. If it means staying overnight with them, at least watch them closely before you can take them to a hospital.
If you can allow me,
briefly.
What about depression in children? And we've seen a lot of cases where young people are committing suicide in the country today. How do you identify that as a parent?
Yeah, there's a lot of stress in young people, in children and adolescents. And in children, it might not be the same symptoms like adults. You find a child who gets a lot of outbursts of anger, a child who refuses to go to school, a child who becomes disobedient. And with the pressure from school these days, there's a lot of pressure to perform. Parents want their children to perform. Even children of kindergarten are expected to get S instead of playing and enjoying their childhood. So that pressure is also putting a lot of pressure on our children and adolescents. And some are resorting even to drugs. Some are giving up and even committing suicide. So we need to watch out and manage it before.
Having a close look on that. Ms. Kibara, Dr. Mutisia, we seem to be receiving a lot of feedback, so we'll try and cover the much that we can within the remaining time. Remember, our SMS line is 22316. As for now, kindly clarify for Anne. She's from Naivasha. She's asking if garlic reduces libido in women. How true is that?
That's a very good question, Anne. And it's not only libido that I've heard about garlic. There's a lot of stories about garlic, and you find even there are people who even don't touch garlic because of so many things. What I can say is that garlic, the onion family, garlic is a natural antiviral. It's a natural antibiotic. It contains a lot of phytochemicals that your body actually needs for you to keep healthy. So I think that one for reducing that is a myth. Because how do you reduce that? There are so many other factors that you watch in your diet. You could be taking foods that drain energy from you. You could be taking a lot of processed foods, a lot of refined sugars, foods that are not healthy. And what I like addressing a lot when I talk about nutrition and diet, sometimes we focus so much on one food. I want to lose weight, so I'm going to take lemon juice. But it's not only that. It's wholesome. It's not only garlic that this person can say. I believe that's a myth, and it should not be the case. And this person should address her health as a cycle. What else does she do? How else does she eat? What else does she do in her health for her to keep well? Don't just look at one food and one item.
And she'll also need to check her blood sugar,
absolutely,
blood pressure, check on her relationship. Those absolutely are things which can happen.
It's everything, not just, you cannot just pinpoint and say one thing.
Okay. And Mercy is waiting on the line. Remember, our phone line is 0204-200-000. Let's talk to Mercy. Hello, Mercy.
Hello.
Good evening to you.
Good evening. How are you?
I'm doing quite well. What's your question, Mercy?
My question is... Hello.
Hello, I can hear you. What's your question, Mercy?
Yeah, I'm saying... I've been with one diabetic for many years. But I've been gaining weight slowly over the years, despite I really worked hard to lose the weight. Hello?
Yes?
Hello?
Yes, continue.
What can I do? I've really been working hard to lose the weight, but I haven't added a lot. I'm now 69 kgs, but my ideal weight is 5. Yeah.
How old are you, Mercy?
33.
33.
Yeah.
Okay, thank you for your question, Mercy.
Okay.
A question to do with
diabetics and weight gain. I'm sure Mercy is worried that if she continues increasing her weight, then that increases, the diabetic risk. But what I can tell her, at least she's doing fine. She's at 59 and she's trying to get to 55. So that's good. Plus minus, it's about 4 kilos that she needs to lose. So if she's doing everything right, and according to her question, I may feel that she is, because she's managed to lose a few kilos. If whatever lifestyle that she has put right now, she's not become monotonous, she can only sustain at 59 kilos, then she needs